Welcome back. When it comes to financial planning, especially in our senior years, there really is a lot to keep track of, so it's important to have the right advice.
It can be overwhelming for a lot of us. President of MJ Wealth Planning is Mike Janke. He's joining us now to talk about your future. Great to have you here.
Well, thanks, Heather. Good to be here.
So we're talking about long-term care today specifically. So what do the real numbers look like for people who need to be planning for long-term care?
Yeah, that's a good question because there's a lot of statistics out there. Depends where you look on the internet.
Right.
But you'll see anywhere from 50 to 75% of people age 65 and older will need some type of care. And to clarify that, when you hear that, a lot of people think, well, that means if I'm 65, I got a 75% chance to go into a nursing home. Mm-hmm. That's not really what they're saying. They're saying that you're going to need some kind of care. So whether that's assisted living, adult daycare, home health care, that really adds up to that 75%. And people 65 and older, the demographics are typically 60, or if you're 65 to 74, that's about 10% of those people are going to need care. From 75 to 84, it doubles, and then from 85 on, it's double that. So obviously, the older you get, typically your health doesn't get better, it gets a little worse. So if you live long enough, you'll need some kind of care.
Yeah, we all need to be thinking about this.
Definitely. You'll want to plan for it because it does cost money. What are the current costs that we're seeing for long-term care?
Well, and that depends too where you live. So Tucson, for instance, if you need assisted living, home health care, things like that, you're probably at about the $4,500 to $5,000 a month range. If you need long-term care, if you need to go into a long-term care facility, you're going to be at about $7,500 a month for a private room. Now, if let's say you're from California and maybe you want to go back to San Francisco. San Francisco, the home health care and those are going to be a little bit higher, but the long-term care, you're going to be paying about $13,000 a month for a private room. And if you've ever seen somebody in a semi-private room, you're going to want a private room.
Right. I mean, this is a stark reality that all of us need to be thinking about and planning right now. How do people pay for their care then?
Well, most people start out by paying out of their pocket. So they have money set aside, whether it's their CDs or their brokerage account or something they've earmarked to say, if I need care, this is what I'm going to use. What happens is most people go through their money. And there's been a lot of different statistics over the years, but one that I remember said that 50% of all people that start to pay for long-term care on their own are destitute within a year.
Really?
So, you start adding $150,000 a year bill to your other expenses, it doesn't take long to go through.
Right.
So what ends up happening typically is that people will go through their money that start, there's about 20% of those people are still paying for their care. There's about 10% that's paid by private insurance, and then a majority of it is Medicaid.
And Medicare and Medicaid don't pay for long-term care?
Yeah, it's a fairly misconception for a lot of people. They think when I get 65, I get Medicare, I get Part A and B, and that'll take care of my nursing home. It doesn't. Medicare specifically, Part A covers your hospital. And they say in Part A that you can qualify for short-term coverage, but here's the hoops you have to jump through. You have to be in a hospital for at least 3 days. You have to go to a facility from there within 30 days. And then at that point, if you meet those criteria, you have to be in a skilled improving condition. Right. So,
a lot to keep track of.
So the majority of people, about 2% actually get any benefit.
Right.
And those 2%, what happens is you get the first 20 days, you'll get covered. Then the next 80 days, you pay about $176 a day for that care. And then after 100 days, you're completely on your own. So it's not designed for long-term care at all. It may help you out with short-term, but most likely not. So what happens is mostly, again, you go on Medicaid. Well, Medicaid is a federally funded, state-operated joint program. And the problem with Medicaid is you have to qualify based on your financials, both your income and your assets. So to get to qualify, you have to spend down your money. You get down to $2,000 of accountable assets, and then you can apply. Well, $2,000 of accountable assets are things like your brokerage accounts, your CDs, your 401ks, your IRAs, pretty much all your money that you've accumulated, you'll have to spend down before the Medicaid
One misstep, right? And it sounds like there are a lot of them that you're talking about. And you don't want to put this in the burden of your family members, right?
No, it changes the dynamic so much. And I've seen it. I've been doing this about 30 years now. And I've seen clients where, they rely on their kids, and that changes that whole relationship.
Yeah.
Kids have their own stress issues, and one of the things I was going to mention is for the provider, who provides these benefits right now is the unpaid family member that provides more benefits than anybody.
But you can help them prepare.
You can, and the challenge is that reality of that environment is going away. People don't live, like, I don't know where your parents live, for instance, but my dad lives in Nebraska. He's 81 years old. I have 3 siblings. None of us are even close to his home. So how are you going to provide that care, even if you wanted to?
You make it your mission so that people don't end up, like you said, destitute and without anywhere to go. So we'll get them the information so that they can get in touch with you. Thanks for being here.
Fantastic. Thanks for having me.
Good education today. Right now, you can get a free copy of Mike's book, Don't Go Broke in a Nursing Home. All you have to do is call 520-745-4438. And for more information, you can head over to mjwealthplanning.com.